Hello guys, so this is the part B of the NEETPG pattern question that we discussed last time. So what was the question? The question was that a 34-year-old lawyer was struck in the eye by the golf ball launched by the ophthalmologist. Ophthalmologist rushes to the lawyer to his office, examines the eye, and he was getting 20% hyphema and no rupture of the globe was present, and we have already seen that which type of glaucomas can occur and which glaucoma cannot occur in this case. Now, what does the part B says? Part B says that because the IOP was elevated in the traumatized eye and we saw that there could be so many things that could be responsible for the rise of IOP and the glaucoma in this eye, proper management of the hyphema could include all of the following except. So, what are the modes of treatment that you have to give in this patient and what should you avoid? First is the corticosteroids, then you have got the beta blockers, aminocaproic acid and miotic agents. If you look at the treatment of hyphema, see we were having the hyphema and we were having the trauma. Okay, now for the absorption of this blood which is present, to decrease down the inflammation you have to give steroids, you have to give the aminocaproic acid, and in order to lower down the IOP we will also take the help of the beta blockers. But what will happen if you give these miotic agents? If you give these miotic agents, they will actually disrupt the blood aqueous barrier. So you have to understand this, that these miotic agents will actually disrupt these this blood aqueous barrier, and the moment this barrier is actually disrupted, the inflammatory cells will actually pass through this. So inflammatory cells will pass through it. When the inflammatory cells are going to pass, they will actually increase the ciliary spasm. When there is more of ciliary spasm, there will be more of pain, more of inflammation, and that can even intensify the raised intraocular pressure due to the secondary inflammatory glaucoma. That was a secondary open angle glaucoma, because if you remember that more and more inflammatory cells, if they are released secondary to the trauma, these inflammatory cells will go, they will block the trabecular meshwork and they will exaggerate the secondary open angle glaucoma. So if I am giving the miotics, that is actually precipitating it. Now I am disrupting the barrier so that even more of inflammatory cells can go and the patient will be having more glaucoma, more rise in IOP as well as more pain. So I think the answer is very clear, that you could include the following drugs in the proper management of the hyphema except, so you don't have to give the miotic agent. So I hope you are learning well and you are enjoying doing these sessions with me, so that you have a good practice as if you are having a final rehearsal before going to the actual examination, and you have a good practice of clinical approach to these questions. Thank you and happy ophthalmology.